A research conducted by scientists at the University of Development Studies has found several food vendors in the Tamale metropolis sell food contaminated with Salmonella. The research also found out that most of the fufu pounding machines in the metropolis are contaminated with the same bacteria. It is estimated that 153 million are infected yearly by Salmonella, with 57,000 deaths. The Department of the Biotechnology of the Faculty of Agriculture of the UDS has been conducting a research in Tamale on the Salmonella in gizzards following reports of the importation of contaminated gizzard into the country from Brazil. Dr Carey Saba is a senior lecturer at the Biotechnology Department. He led the research.
The Department of Biotechnology for the past 7 years has been working on the contamination of Salmonella in foods in the Tamale metropolis. The research, which was conducted last year on various food samples, had between 80 and 100 street food vendors. Dr. Saba said people are being infected with Salmonella without knowing.
And we have worked on a number of food samples, specifically street foods, ready-to-eat food. And for now, we found Salmonella in a number of them. Fufu that is sold by the roadside, we have gotten Salmonella from some of them. We went ahead to sample the fufu making machines that we have now. We got Salmonella from them, and we also realized that because they don't clean them very well. We got Salmonella from samples we took from pepper sauce that they used to serve with kenke. And I must tell you that we found Salmonella in them as well. Apart from that, we also sampled frozen chicken some time ago, and we had some Salmonella in them as well. People are being infected with this Salmonella, but they may not know. They may attribute it to other sources, since they are not aware of the food that they are, or they are not aware of how the food they are eating is prepared.
He said the department has also done a research on gizzard following the recent reports of contaminated gizzards imported to Ghana.
We visited almost all the cold stores, and precisely 39 of them, and we were able to get gizzard from 20 of them. Out of the 20, we found out that 13 of them were from Brazilian origin. 7 were from Turkey and 1 from the UK. So we took those samples, brought them to the microbiology lab here, conducted analysis of those samples microbiologically, and basically we found out that the samples we took were all negative for the Salmonella.
Dr. Saba called for a collaboration between the university and other stakeholders for more research.
We are open for collaboration, and this research we have carried out, I must say, normally from our meager resources, at times from our salaries. So if I have the means, if I have sponsorship to carry out this periodically, at least in Tamale, I'll be glad to do that.
He called on people to ensure that food they buy from the streets are hot.
My advice generally is to consume food very hot. When you buy food that is not hot, you can go on to heat it before you take them. Or also with the meat samples, what you need to do is to first boil them directly when you get home. Put water on fire and boil them directly before you start cutting them.
JoyNews sample views of some residents on the contamination of foods with salmonella.
I think as a research institution, I want to propose that we should have courses with food audit and traceability, so that these people will serve as experts. And also we should have quality assurance scheme. So once this food product come into the public, we have people who will check them, and once they pass that, it is of good quality, because we trust the quality assurance scheme. I think everything will be fine.
I was quite disappointed because I was thinking the regulatory bodies should have upped their game in order to track this. So when I heard already some containers have been released to the community, I was quite disappointed.
Martina Bugri filed that report. Now, here it sounds like a very scary case. Let's get on the phone line now. I have Dr. Carey Saba from the Department of Biotechnology, University of Development Studies. They conducted this research. Sir, thank you very much for your time this afternoon.
And thank you to...
Right. I just want to find out... Right. Sorry. I just want to find out quickly, was this research motivated by the recent news reports about the entrance of bacteria-infested gizzard?
Yes. The gizzard samples were taken because of the recent news of the 4 containers imported into the country. But the rest of the research we did have been going on for about 6 to 7 years now. Wow.
So I just want to be sure that this Salmonella we're talking about is not a different bacteria. I mean, it's not different from what was brought in through Brazil. Is this bacteria that's familiar to our environment here in Ghana?
Yeah. So I was looking at the certificate that was brought from Brazil. They indicated that it was Salmonella enteritidis that was suspected in the sample. And what we did, the analysis we did, is to look for such type of Salmonella. I must also say that we have 2 general species of Salmonella, which is Salmonella enterica and Salmonella bongori species. Salmonella enterica species, they are dominant, and we have almost about 2,500 serotypes of them. Then Salmonella bongori, they are in the minority. They don't generally cause disease per se, but some have been implicated in certain foodborne outbreaks to human beings.
Okay, and this is exactly where I wanted us to come to, because I want us to assess the extent to which this bacteria is life-threatening. And the last time I spoke to the FDA, one of the questions that I asked them was, what really will make you know that you've been infected by something like this? And I was told that there are symptoms such as vomiting, weakness. Educate us a bit on the symptoms. Should you consume something that's infected?
Generally, symptoms from the acquisition of Salmonella are normally likened to the general diseases that we have here, especially malaria. So people tend to think that it's malaria, even though it might be Salmonella. So the general symptom is that when you consume food that is infected with Salmonella, within 6 to 72 hours, you may, that is the incubation period, you are likely to have certain symptoms if your immune system is not very strong. The symptoms are fever, weakness. You have weakness. You can cough. There will be abdominal pains or cramps. You have diarrhea. In certain cases, people have constipation. and this may last for 4 to 7 days. If you have your immune system okay, you should be able to overcome the disease with 4 to 7 days. But those who are normally at risk are those we call immunocompromised people. The immunocompromised group are children, the aged, pregnant women, and also those who are already sick.
Right. So it's possible that we recorded deaths from this particular bacteria, but
of course.
But there's no research to link it directly to it, is it?
Let me give you the estimated figures we have annually from the world. In Ghana, because our system is not well mature to record those infections, we don't know how big the situation is.
Right.
But annually, it's estimated that this Salmonella causes about 153 million infections.
Worldwide?
Yes, 153 million. And out of these, 57,000 people are estimated to die globally out of this infection.
Okay. Let's look at what we can do in terms of preventing deaths from this. You've indicated already that this is obviously a life-threatening bacteria. This is obviously a public health threat. But is there any collaboration going on to reduce the extent of threat that Salmonella poses to public health? Are you working on any such collaborations with public health institutions?
Actually, no. What we just do is to make sure we bring the results.
Okay.
We do risk analysis. So we do initial sampling of those food samples. Then we come out with the initial results. And those who are concerned can go ahead to collaborate with us, because actually, even our research is not sponsored. Right. We do everything on our own.
On your own. I understand that you've given some of your recommendations to the Food and Drugs Authority. What sort of response did you get?
Yeah, I gave a proposal to Food and Drugs Authority following from the results we got from street food that we have in the Tamale metropolis about a collaboration where we will sample restaurants and be classifying them based on their level of cleanliness, and also based on the presence of these organisms in them. Last year, I gave them the proposal, but I've not heard from them yet. I'm still waiting. Maybe they are in the process of getting back to me, but since last year, I gave them such a proposal, but I've not heard from them.
Hopefully, as we go along with this discussion, we'll raise it with the Food and Drugs Authority and find out what they say about it. They themselves have told us, I mean, when I spoke to their communication director, he indicated to us that they were going out to find out where these packs of gizzard were sold so they can conduct their own research there. So hopefully we'll get back to that. Dr. Saba, thank you so much for the great work that you're doing. So essentially they did a research from the University of Development Studies. They did a research that shows that there are significant amounts of Salmonella, which is a bacteria, in food that is sold on the streets of Tamale, in Tamale metropolis, because that's where they conducted the research. Chances are we could be doing same here in the city and across the country. But they said they're looking forward to hearing from the FDA regarding a proposal they sent to them so they can work together on this.